Treatment options that we have for treating sleep apnea are fourfold. What we try to do is get the patient the best possible option for them personally. The most common treatment for sleep apnea is the CPAP, constant positive air pressure. And what that does is it puts air from a mask that's fitted onto either their nose or their full mouth, or maybe it's just a couple of tubes that go through their nose. But it blows air down the throat, blowing the tissues apart, allowing a person to breathe freely because of that. It's a very good treatment for sleep apnea. The concern is that there's about 50% of people that wear the CPAP that cannot do so. So they are intolerant. Because of that, there has been other options that have been put out there that maybe can be a little bit more comfortable. The other options are this. One would be weight loss, and the weight gain or weight loss will affect the sleep apnea. The heavier a person weighs, the more extreme the sleep apnea. Another one would be surgery, where we would have something called a UP3, a moving of some tissue in the throat that allows for the airway to be opened up. Those can work sometimes. There is a lot of times that they don't work. Another option would be a mandibular repositioning appliance that is given and fitted from a dentist, and it positions the jaw forward, holding the jaw in a forward position. So that allows for the airway to be open, because when the jaw is held forward, then the tongue stays forward, opening the airway so a person can breathe freely with that mechanical device. The CPAP works by blowing air down the throat. The oral appliance, the mandibular repositioning appliance, works by moving the jaw forward, which in turn holds that airway open. One of the greatest things that I've become very passionate about is the success of the mandibular repositioning appliance. We have one called a Herbst appliance. There's over 50 of these different appliances that have been FDA approved. They have been approved to be used successfully since 2006. And a lot of research that was done to get that approval, both with the FDA and also with the medical academy that deals with sleep, the American Academy of Sleep Medicine. The mandibular repositioning appliance works by simply holding the lower jaw from falling too far back in the mouth. So when you begin to fall asleep, your jaw falls back. It can only fall back as far as this hinge will allow it to. So it simply keeps the jaw from falling back. You can bring it forward, you can open, you can talk with it in place, you can still, you can function. It actually also protects the teeth from them grinding them together, and becomes a very nice protective mouth guard, at the same time stopping the obstruction from happening and the airway from being blocked up.